All right, friends. I'm so excited for another fireside chat. I'm going to be doing a lot of these in the near future because I think it's really important to take people from a place of not knowing to knowing. So you cannot access and utilize certain modalities if you don't even know they exist, if you don't know they're out there and available to you. I personally trying to use as many modalities as possible. I'm like, I'll take some of that, I'll take some of that. Because when you do that, you can really approach your health issues foundationally. And so, I'm really good at what I do, but I know I don't do everything. And so I personally love using other practitioners, chiropractors, acupuncturists, all of the things because it just supports overall health and wellness. And I know that acupuncture can be a scary idea for some people. And I just want to tell you it doesn't have to be, and it can be life-changing and amazing. So before we dive into all the rabbit trails and all of the topics, I'm going to introduce Megan, and I will butcher probably every other word in her bio because I don't know how to pronounce anything in Chinese. But just bear with us, I'll get corrected. But besides the fact that, okay, first I have to start before her actual bio. Give you a little heads up. You walk into Megan's clinic, and it is literally like walking into the home of your best friend. It is cozy, it is comforting, it feels safe. The vibe is like, oh, it's like you can just walk in and relax, right? You know you're going to be seen, heard, safe, taken care of. There's not like 20 people in your face, you're trying to get you to do things. And she's got just these walls of herbs that is it's just cool. So you walk in there, you're like, I'm gonna be with an expert, but who also has the demeanor of my bestie, right? So, it takes something that can be really clinical and makes it very comforting. And so that's the unofficial bio. Okay. Megan McFarland, LAC, MAC, CHM, is a Texas Medical Board licensed acupuncturist, NCCAOM. I'm not going to say it right. Diplomate. Aha, I did it. Chinese herbalist and certified clinical Western herbalist practicing in Southwest Austin, Texas. She's the owner of Coyote Herbs and Acupuncture on Nutty Bound Road, where she runs a family-style holistic health practice, working with people of all ages on a wide variety of health complaints. Drawing from various holistic modalities, including acupuncture, nutrition, and herbal medicine, she works collaboratively with her patients on and off the treatment table to empower them to make healthier lifestyle choices so they may lead a more peaceful and fulfilling life, free from the restrictions of pain and disease. Born and raised in Southwest Austin, she received her 4-year master's in acupuncture with a specialization in Chinese herbal medicine from Southwest Acupuncture College in Santa Fe, New Mexico, and her certificate in clinical Western herbalism from the Wildflower School of Botanical Medicine in Austin, Texas. That just sounds cool. I want to go there.
Cool.
She has additionally studied master tongue
Yes.
stuff. That's cool. Acupuncture in Chengdu,
Yes.
China. Ooh, look at getting some right. With Dr. Lin Zhang Tai and
Close.
reflexology and gua sha and Shaoguan, China.
Shaolin.
Shaoguan.
Yeah.
Oh, okay. I'm like sort of off. She has studied bioregional and folk herbalism with various teachers around the United States since 2012. Basically, Megan knows what she's talking about and she knows what she's doing. And she's an expert, right? Like
Full time.
she's an expert in her field. And I love that Megan has such a variety of training, whether it's creating her own tinctures. I've been taking tinctures home that she's made specifically for me. Or I'll just, it's not just straight up acupuncture, for lymphatic drainage. It could be a little facial. It could be, so many cool things when you have the option of doing it. The other really cool thing about Megan is that she practices with such love and integrity. And you just can go see her knowing that you will be absolutely taken care of in the best way. So what is acupuncture, Megan? For those who've never experienced it, for those who've like, that's
Sure.
just for hippies.
Yeah.
What is
Yes.
it? Tell us about it.
So acupuncture, very simply, is just the insertion of very fine needles into specific points on the body to initiate a healing response. And those needles are very, very small. They're about the width of a human hair. And they're called filiform or solid needles, as opposed to holoform needles like you would use for an injection or a shot or to draw blood. So in that case, sometimes at the cellular level, the skin cells will actually part way to accept the needle. That's how small they are and how sharp and how finely crafted, which makes it a lot less painful than a hollow form needle, in which case they're taking out a chunk of flesh. So I always preface that when I talk about what I do, because I think the needles are a little bit difficult for people to get around. But acupuncture really is for everybody. That's the slogan of my business, because the tradition that is most widely practiced and that's fully intact, the oldest lineage, is the Chinese lineage. But actually, acupuncture has been practiced by all cultures all around the world for millennia, including European cultures, North African cultures, Indigenous American cultures. It's actually, there's traditions all over the world. But the Chinese still have intact texts that we study today that are over 2,000 years old. So
cool.
that is why, exactly, that's why it is the most widely used and still taught lineage.
Gotcha. That makes sense. And so what would you say to somebody who says, I'm really interested, it could probably help me, but I'm terrified of needles? Like, what is
Sure.
your approach for helping someone work through that fear?
We take it really slow, and there are ways to perform acupuncture without inserting needles, but you're not going to see the result, because really the beauty of acupuncture versus acupressure or using some other kind of tool is that we can go directly to the targeted tissue with the needle. So we can actually go into the muscle or to the fractured bone or go over an organ or work with a myotome or a dermatome. And that tends to be a lot more effective when we can insert the needles. So I tend to use even smaller, really fine needles for people who are concerned about the pain. And then we work with kind of breathwork techniques and just take a really slow, calm, relaxed approach and really only go as far as the patient's able to handle.
Well, and I got to see this with my own son, and I
Yes.
really wanted him to go see Megan, and he was like, but he had it in his mind it was going to be way like this crazy thing, and he got to see me, do mine, and then Megan put one in his hand, and my 6-year-old even let her put one. I was like, look at, but so, and then afterwards he's like, oh yeah, that was fine, So I think that we create stories in our minds about it being a certain way when the reality is it's really relaxing. When Noah, every time Noah left, he's like, oh, I'm just gonna take a nap now, and so it can be like if I've come to you just super like revved up, nervous system bouncing all over the place, and leave just chill and just feeling so much better. So let's talk about energy flow and why it's important. And if your energy is not flowing, what that can lead to symptom wise.
Right. So there's a couple ways to think about energy flow in Chinese medicine. So this is kind of where I think some Western practitioners get tripped up, is because we'll use terms like qi or energy, and they think that we're doing something that is spiritual or belief system based and not based in physiology. But acupuncture, you have to understand, comes from a culture where the basis of their epistemology or their way of seeing the world is really that nothing exists in a static form. And we know this now at a quantum molecular level, that really nothing is static. Everything is in flux, is in change. And so when we look at the body and acupuncture, and we see a disease state, we're not seeing it as, oh, you have hypothyroidism, we put in points for hypothyroidism. We see it as, where did the disease begin? What is the momentum of the disease currently? Where is it going? And then we try to intervene in that momentum in order to bring someone back into a state of health, which I think I've heard you say something similar before, Becca, and
Yeah.
some of your stuff is that when we're looking at things from a holistic perspective, we're not seeing the label of a disease
Yeah.
as some sort of static fixed reality. It's
Right.
just the way that things are going now.
Yeah.
So that's kind of one way that we talk about energy.
Okay.
And acupuncture points themselves, the way that they're looked at is that there are channels, the way that energy flows in the body. And when we put those needles in the channels, we are then adjusting that energy. And those channels have been kind of related back in Western terms to things like myotomes or dermatomes, which are where the skin and muscle nerves are innervated by the same dorsal nerve that then innervates an organ, and therefore we can affect internal physiology. And then those channels also flow over other kind of major structures in the body, like lymphatic structures, blood vessels, even over the organs themselves, et cetera. And so in many ways, it's much easier to kind of understand this kind of complex interrelated physiology if you follow these sort of several thousand years old mapped out channels and their organ associations and affiliations.
Cool.
But the other concept of energy that I think is really helpful is I'm a gardener and I love gardening. So I think about things in plant metaphors a lot. And it's like, imagine it this way, when a bulb goes into its root in the wintertime and then it springs back out in the spring, well, we can see that that life force energy is going into the ground and then it's coming back out in the springtime. And just in the same way, our body also has an energy flow, and that energy flow is mapped out on the body in these meridians. And so we are adjusting the flow of energy to be appropriate for a state of health or homeostasis, essentially.
So,
So go for it. Go for
well,
it.
what would, so like if someone had some stagnation in their
Yeah.
energy flow and their channels where,
Yeah.
something was causing a roadblock,
Right.
how does that prevent symptom or how can it, I know, and it depends on what's blocked and all of
Yes.
that,
Yeah.
but like, what are some common symptoms you see from just simple stagnation?
Right. So I think the easiest example is pain.
Mhm.
Um, So if there is a stagnation in energy flow of the channel that goes up the spine, let's say, and that can be due to energy, I mean, that can be due to an accident
Mhm.
or an injury, that will cause a level of stagnation because the body's actually shunting things to that area and the muscles around it are tightening to hold that area in place. And we kind of see that metaphorically as a stagnant and literally as a stagnant energy. It's stuck there. And what happens over time is that, as you know, the body eventually stops really sending resources and trying to heal the area. And then what it does is it creates structures that will crystallize that area. And so it can't move at all. So that's when you start getting things like bone spurs or spinal stenosis or issues like that that come from long-term stagnation. The body's life force energy is actually stuck there. And so it's just accumulating resources to create more stagnancy. And what we need to do is go in with the needles and remind the body, hey, this area is not right. This area is injured, and bring fresh blood, fresh resources to that area to heal it again.
Mhm.
So it's kind of this concept of a micro injury almost where we're saying, hello,
Just reminding, like a little like knock knock on the door, right?
yeah, yeah, I know you've forgotten about this area and thought you couldn't do it, but maybe now that you're in a healthier state, you can. So let's go back in and see what we can do.
Nice.
So,
And one of my favorite things that Megan can do, I hold a lot of tension in my shoulder area and they'll just lock up and my neck will lock up and that'll lock up and then it just locks everything up and then I'm a hot mess. And she can do something called dry needling, which releases that spasm and it's not painful, it's weird. It feels a little like, "Oh, that's interesting." But it's wild how it releases so quickly. Can you tell us a little bit more about dry needling?
Yeah, so dry needling or trigger point style acupuncture is one of my specialties. Not every acupuncturist practices it. But basically, it's really simple. It's just we go into the hyperexcitable area of a spasmed muscle. we put a needle in it and create some discomfort in the muscle by adjusting the needle rapidly. And the muscle's like, oh my God, I don't know what's happening. I guess I just have to release. And so it's very simple, but really, really powerful. And it's a really effective technique for chronic pain, like what you're saying.
And
Yeah.
could you do it? Is there any place you wouldn't be able to do it? So if someone has, leg pain or shoulder pain or back pain or arm pain, like, is it appropriate to do pretty much anywhere?
It is. It can be used for any muscle in the body. I use it for like temporal muscles on the scalp.
Mhm.
I even use it for issues in the rib side area. You have to have really good training to do anything over the lungs, by the way. So I wouldn't have your physical therapist necessarily go in there and
Right.
do needling on you. But as an acupuncturist, we do. Paraspinal muscles in the back are another high risk area, but we can do it. The only areas where I'm hesitant to do dry needling are the palms and the soles of your feet. And only because it is way too uncomfortable. We have other methods that we can do that work just as well. And so sometimes, massage is a little bit more appropriate.
Gotcha.
Yes. Yeah.
And is dry needling, how does dry needling differ from adhesion release? So I have a lot of scar tissue and adhesions from 3 abdominal surgeries. And I'm working with Megan on releasing them, but it's, if my memory serves me correctly, it was a totally different
Right.
methodology. So can you tell us a little bit more about, like, so if someone has scar tissue, I know I fully believe my scar tissue is impacting my gut health
Right.
after 3 major surgeries. And so why would it be important, one, to release adhesions of the
Mhm.
scar tissue? And then what's the process behind it?
Yeah. So the problem with scar tissue is that it's not there's not circulating blood flow, which means there's not circulating the body's nutrition and all the things that it would, immune cells and everything are not flowing to wherever the area of the scar tissue is. It's just a reservoir where the body said, we're not sending resources here anymore. We're just going to shunt that area off, like we were talking about. So we see that as a big problem. And it
Mhm.
does tend to be areas like you're saying, where people will have like gallbladder surgery, let's
Mhm.
say, and they have a huge scar there. And then suddenly they're like, well, why am I developing these like large intestine compaction issues? Or why am I
Mhm.
developing these liver issues? And it's like, well, you've got a massive amount of scar tissue where the body's not able to send blood,
Mhm.
life force energy, and therefore it's affecting peristalsis and these other kind of issues. So that's why scar tissues are important to treat. And they can also lead to chronic pain and
Mhm.
numbness and lack of sensation, lots of things like that.
Yeah.
Dry needling is literally just going into the hyperexcitable part of the muscle.
Mhm.
But when we're talking about adhesions, we're talking about multiple layers.
Mhm.
And so you've got your skin, kind of the wrapper on the outside, and then you've got the muscle. But in between them, as you know, we have the fascia, which
Yeah.
is like this electrified plastic bag that's kind of in between your skin and your muscles, that's allowing your muscles to move under your skin. And when you have a surgery, they cut through, or there's an injury, they'll cut through
Mhm.
the skin into the muscle, and the fascia, the skin, and the muscle will adhere together. And
Mhm.
then that movement between the muscle and the skin can't occur at all. And that leads to chronic pain in more ways than you can imagine.
Yeah.
So
Well, I would think, yeah, if it's kind of like it's like you super glued stuff together that should not have been super glued
exactly,
together.
exactly. The body's just trying to heal, but
Yeah.
it didn't heal properly. And
So
so,
but you are able to go and intervene. So let's say you're super glued together, for lack of better technological words there. But you are able to go in there and release the super glue. Yes.
yeah, again, it's that kind of micro injury idea. We just go
Mhm.
back into the old injury with fine needles. We surround the scar, and we're kind of getting in between those tissues and saying, hey, pay attention to this area again. We need to
Mhm.
review this again. This isn't quite working. So
Mhm.
sometimes it's actually physically breaking up the scar tissue with a needle. And
Mhm.
sometimes it's, surrounding the scar and saying, let's take another look and see if you can heal this in a better way.
Yeah, and I can imagine, especially abdominal scarring, because it can impact so many organs, digestion, hormones, all of the things. That it's multifaceted how much releasing those can help you, not just ease of movement and pain, but then to have everything that's nearby
Right.
to function better. And what I love about it is, I mean, you might hear the word needles and acupuncture and think, oh, that's really invasive, but it's really not.
Very gentle.
And it's very gentle. And, sometimes we need really intensive approaches. Like I'm recovering from, for those of you who are watching and don't know, a shoulder reconstructive surgery where I fully ripped two tendons off my shoulder and had to be put together, right? Sometimes interventions are pretty drastic, but I love it when there are options out there for someone who's maybe not a candidate for surgery, or that's really not the best fix, that you still can make a difference. I feel like some people think, well, it's surgery or nothing, right?
Mhm.
Like it's the big things, or I don't really know what to do. I'm just stuck, right? And it's so, I think, amazing that there are options like this
Right.
out there for supporting that healing, for supporting that improvement, for people who feel like there's no option, but there's lots of options.
Yeah, there's lots. Exactly. Exactly.
And then for something like that, especially with like the fascia and all that, how does the gua sha kind of integrate into that?
Yeah, great
Do you like that segue?
comment. Yeah, great segue there. Yeah. So gua sha is a great tool that I love because number one, I love things I can give to my patients and they go home and do for themselves because
Yeah.
they're going to get so much farther if they're doing something for themselves every day than coming to see me twice a week or once a week or once a month. And the gua sha is super easy. You're taking a hard edge and you are just mobilizing the skin over that area of adhesion
Mhm.
and kind of just manually breaking it up and bringing fresh blood flow to the area. So again, it's just like very simple technology that makes a huge difference
Mhm.
that we're not taught to think about at all in modern.
Yeah. No,
Yeah.
not at all. And I mean, I've had decades of physio structural things. I had a massive neck injury in high school, and just different things that, I was never told anything like that could be helpful. And I love that, yeah, for certain things, we have to come see you, but I love that there are tools and resources that you can then learn and go do on your own. Just
Right.
like for me, like if I'm meeting with you every other week, but you don't do anything between, if you're just doing nothing, well, you're not going to make the progress that you want to do. So I love that there are different things that you can do to just keep the momentum
Yeah.
going. Now, what's the difference between like just the traditional, like opening up energy, channels and all the things we've been talking about versus doing an acupuncture facial? Tell me more
Oh,
about that.
yeah, the acupuncture facials are so cool. So just like we talked about releasing a muscle, like say in your back, we can do the exact same thing to the muscles in your face. But Botox, they use botulism toxin
Mhm.
to paralyze the muscle. Well, we just go in and manually release it, and then the issue is gone, essentially. And sometimes we need to do, it's kind of like starting a workout routine where we have
Mhm.
to go and remind the muscle to relax
Mhm.
several times before you'll see the full result.
Well, when
But
you
you,
say result, what do you mean? Like, what could we expect? Like, do we
yeah,
do we look 20,000 years younger, or is it wrinkle reducing? Like, what is the
yeah.
desired end goal for that sort of process?
Well, you know, first of all, I'll say, not to sound too vain, that you can treat the whole body through the face. So it's kind of a
Mhm.
homunculus or like a microcosm of the whole body. So we can see issues in the various internal organs in the face and we can treat those through the face, which is really freaking cool. So it's
Huh.
not just because you want to look younger and
Oh, well, just a good side effect though, right?
I that. But I also don't see anything wrong with wanting to feel beautiful and work on
Mhm.
your appearance. And so I have absolutely, I love doing facial acupuncture. And I think it also, prevents people from going out and getting injections and so forth, which we're now seeing have all of these potential side effects. And of
Yeah.
course, they're a relatively new technology. So who knows what happens, 10 years after you've had injections for a while.
Yeah. I love
So
the idea of something like that, like, as far as a beauty treatment or whatever goes, to um create the best looking skin under, in your face, but without it being, there's no long-term negative side effect.
Right. And the cool thing about it too is, a lot of us have heard of microneedling and how that can improve collagen production and cell turnover. And acupuncture and facials do the same thing.
Okay.
So when we're putting the needle in there and we're bringing that fresh blood flow to the face and that life force energy to the face, again, the body is remodeling the structures in there. So we're releasing muscles to decrease wrinkles, and then we are improving collagen production and blood flow, and also just the basic tone and glow of the face. And the results are great. Also can be great for migraines, sinus problems, TMJ, all of that stuff. We can all address that while, working on your beauty, your natural beauty, and your appearance as well.
Okay, sign me up. I'm
Yeah.
sold. I mean, if I have to do any more of this, like, the little right here, like the mom stare,
Yes.
gets that one right there. Well, yeah, and so, but you also offer. Okay, let's talk about cupping. I've never done cupping. What's the purpose and what is it?
Yeah, so cupping, it's basically a big suction cup that
Mhm.
pulls up again. So it's breaking those fascial adhesions by pulling the fascia and the skin away from the muscle. But then it's pretty intense, so it will actually even pull lactic acid and any accumulated toxins out of muscle or fat or wherever else they may be. And it can also do things like help with peristalsis. So if someone has chronic constipation,
Mm.
I can do cupping around the large intestine and kind of help to move that stool down the large intestine naturally. So cupping does a lot of cool things, but I think the main thing I use it for is to pull lactic acid out of those spasm
Mm.
muscles. And when that happens, then again, we've brought fresh blood flow to the area. So
Mm.
we're asking the body to heal, and we've pulled out whatever is keeping that spasmed and tight. And it leads to a lot less soreness and chronic pain, and also greater mobility.
Mhm.
So
So if you had, an injury or just chronic pain or
yes.
stiffness or, I can tell certain areas of my body when I'm inflamed. I'm like, well, what's going on with that? Like you can feel it, right? And so there's what I like about this idea of cupping is there's an alternative. So if you're like absolutely not no needles ever, right? Like there's still other things that you can do that don't involve the needles.
Exactly. That's right. Yeah. So I can do
Okay.
specifically cupping if people just want a cupping treatment as well.
That's awesome. Okay,
Yeah.
you coming back to the face and
Sure.
how like certain organs are struggling.
Yes.
Um, one of the things I think is most fascinating that I don't know enough about, but you do, is what you can learn from your tongue. Like
Yeah.
what a cool assessment is that. So if you go see Megan and she's doing her initial assessment, she's going to tell you to stick out your tongue at her.
Yeah.
Why are you going to ask people to do that? Cheryl's laughing. She's like, yeah, it felt weird.
Yeah.
I don't know. So what can you learn from the tongue? Why is that important?
Yeah. So, back in the old days, before they had imaging and diagnostic labs, they started making associations between, different parts of the body and the way that different parts of the body were looking at and how they reflected the state of the internal organs. So it was a necessary diagnostic tool before we had other methods. And what was developed over several thousand years was this idea, which proves true in clinical practice, that again, it's like the entire body is mapped smaller and smaller and smaller on these different specific areas of the body. So, for example, there's the tongue map, which shows the state of the body and all of the internal organs. There's an ear map. There's an iris map. There's a hand map. There's a foot map if you've ever gotten reflexology. And so the tongue map is one of those.
Okay.
And basically, if you were, you can imagine it like the tip of your tongue is your head. And
Mhm.
then it's like you're laying back with your feet towards the back of your tongue. And each area of the tongue has a different association with internal organs and structures. And it's one of the tools that we use to properly assess and diagnose where exactly the issue is.
So
So
if your tongue is like, if your body's super healthy, what should your tongue look like?
it should be a lovely shade of pink. There should be no cracks in the tongue. It should have a solid body. It should have smooth edges, not scalloped edges. It should neither be swollen nor thin, and it should have a nice, thin, clear to white coat that's even all the way through.
So what do the scalloped edges mean? What does that indicate?
So it means a couple of things. First of all, just basically, it means that you're pushing your tongue against your teeth.
Mm-hmm.
And the reasons that you would be doing that, number one is stress. So it tells us about the state of a person's stress. They have a lot of, they're holding in their mouth. Another thing is it tells us that the tongue is swollen beyond its normal means, which means you have some kind of level of edema and you're not processing water properly.
Okay.
And in Chinese medicine, the organs that we say are associated with that are the spleen, pancreas. So it's lymphatic flow essentially, and the ability of enzymes to digest our food and blood sugar regulation. So there's something wrong with your metabolism. Either your stomach or your spleen or your pancreas aren't metabolizing fluid properly. And so there's swelling that's occurring.
Okay. Huh. That's so fascinating. All right. What about cracks? What do cracks tell us?
Cracks tell us about old injuries and injuries to internal organs from chronic inflammation, usually, or some kind of chronic microbial disease process that's happened. Or it could even be, especially in the center line of the tongue, it can be oftentimes the digestive organs, but it can also be injuries to the spine. So you'll actually see spinal injuries or neck injuries reflected on the tongue. So very fascinating. And the cool thing is that a lot of times when you take your herbs and you go through acupuncture and you start to heal, those cracks will heal up as well.
That's what happened to me. I had a huge crack that within, I think after my first session, it was 50% better. I was like, what just happened? It's crazy. Okay. If your tongue is pale, what does that mean? Not pink, just like a
pale
gray, like a light gray or something.
Yeah. So there's different kind of shades of pale. If it's kind of a gray or purplish color, that means deep-rooted stagnation. And oftentimes, if it's kind of that pale purple, it means it's stagnation due to what we call internal cold, which is sort of a lack of movement of life force energy due to a lack of like yang or forcefulness or just the ability to kind of play out your life essentially. And so we need to warm that up. So lack of circulation, essentially. If it is just pale pink and it's quite pale, that can mean a couple of things. Anemia, so just a lack of enough blood. Somehow you're not metabolizing your food properly. You're not getting enough nutrients to create blood. Or it generally relates to really low energy and fatigue as well, which we know, of course, is correlated with anemia. So it's kind of a chi deficiency with this low energy part and a blood deficiency with this anemia part.
So interesting. I really think it is because, if you know these things, you can look at your tongue and say, oh, I got some problems. I gotta go see Megan, right? But it's such a great, you can do it with your kids, right? Like stick out your tongue at me, let's look. And obviously I don't know the nuances and the details, but what a quick little snapshot of something's not right. And we can do something about this.
Yeah.
So I think it's just really fascinating. Is there anything else on the face that like the general person who's not trained can look at themselves and think, maybe I should go, maybe this is a sign that I should go, whether it's like under eye bags or dark circles, like what else can you tell about how your body's functioning from how your face looks?
I think the dark circles are a great place to start. The dark circles are usually talking about the state of your kidneys and adrenal glands. So as we know, dark circles can be dehydration. So the kidneys are stressed. There's not enough water processing through. Or it can be even further adrenal fatigue. Those adrenal glands sit on top of the kidneys. And so when there's a deep level of fatigue, you often see those dark circles. And sometimes it's genetic as well. There can be a genetic component. But that genetic component can be a predisposition to adrenal fatigue, or it could be a predisposition to weakened kidney function. So we always verify with several other symptoms that complete the picture. We're never like, oh, you have cracks on your tongue, therefore, but it is a pretty interesting snapshot. Yeah. Or you might have puffiness and edema. And then again, we're talking about a water metabolism issue. Or if there's pallor, again, we're talking about kind of like maybe even a subclinical anemia kind of problem. And of
Growing
course,
up, my mom would always pull open my like under my bottom
yeah,
eyelid and be like,
yeah,
"You're anemic," right?
exactly. That's right. Exactly.
No, look at her. She didn't even
All of
know.
those things. Yeah.
So what are some of the most common symptoms people come in with that are really not easily treatable, like not necessarily one time, but like that people can really make progress in sooner rather than later if they come, pay you some visits.
Pain. Pain is number one. Acupuncture is so effective for pain. It doesn't really matter the etiology. And again, like you're saying, if we can avoid surgery, let's do it. We can't always,
Yeah.
but we'll always be honest about that. Sometimes all you need is some soft tissue work
Hmm.
or an old injury to get another chance to heal.
Hmm.
And it can make a huge difference in everyone's lives without having to resort to opioids or all of these other things that we know are problematic. So I'd say pain is number one for sure. But there are so, I mean, it's a complete system of medicine. I see a lot of fertility patients. I see a lot of patients with chronic insomnia is a great
Hmm.
one that there's really no great Western treatments for, and
There's
acupuncture
really
works
not.
great
Yeah.
for.
Mhm.
Stress, anxiety, depression, especially as kind of a preventative sort of
Mhm.
management situation. Acupuncture is really effective.
Mhm.
Skin issues, there's a lot of, especially like eczema, psoriasis, there's not a lot of great treatments for that.
Mhm.
So there's so many.
What
Yeah,
about
but
like
I
bloating,
mean,
constipation, IBS?
huge, huge. And again, that's one where there's not great treatments for. And so that's where the part of my practice that's like diet and herb therapy
Mhm.
especially come in because we're talking about digestion. That's your everyday
Yeah.
routines going to greatly impact how your digestion's working.
Yeah, I
So
mean, I tell people all the time, you can't out medicate, out supplement, your lifestyle. Like,
right.
there's no such thing as a magic pill. So, if you're eating junk all the time and not moving your body and not getting sunlight and all these things, like you can take all the things you want, but it's not going to, you're not going to change the way you feel just by
Exactly.
doing that. So really taking that whole body holistic approach is, it's like I can show you how to eradicate H. pylori with an herbal protocol, right? But you also have to, support your liver and support, just all of those connected things.
Yeah.
All right. I've been super excited to bring up this topic. What is a plant ally?
Oh my gosh. Wow. Deep dive. I
I
love it.
know. Well, that was
Um,
one of the things I was most excited about for me. I was like, I have a plant ally. It's like my plant bestie. Let's talk
yeah.
about plant allies.
Yeah. So there is a part of my practice that I feel like we're all very interconnected with the natural world. And
Mhm.
I think part of our healing on a deeper level is recognizing that we're not alone. We're all interconnected. Every being on this planet and where we live, we're all in this together. So a plant ally is sometimes through the diagnostic process, the long conversation that we have at your initial exam,
Mhm.
going through your history, your symptoms, the tongue, the pulse, looking at what your issue is that you're coming in for. There can come to mind a certain plant that would be extremely, especially supportive for you to take every day and to be with for a little while and feel its medicine for a little while. So, do you mind me sharing your plant
Absolutely. Go
ally?
ahead. Go ahead. Tell.
So,
I am such an
yeah,
open book. I'm like, tell all my details. It's all good.
yeah. So your plant ally was passion flower,
Yeah. And I've
and
always loved that flower to begin with. So
yes,
that was delightful, a little delightful piece of it.
it's a beautiful plant, and it grows so well in our region. There's native passion flowers, and it just grows. It's gorgeous. And so there's something about passion flower where it really, I feel like matches your personality. It has this like beautiful showy flower It's vining, it's exuberant, it wants to do all the things and go to all the places. It loves, like the warm climates and being
Mhm.
outside and the sunshine. And so that reminded me of you. But also, passion flower is for when you've had chronic inflammation, and this
Mhm.
has led to a state of insomnia over time and affected your heart organ.
Mhm.
So, and it also has like kind of a slight antimicrobial property as well.
Mhm.
So, taken all together, the symptoms really matched you as a person. And
Yeah.
it's a very safe herb. So, it's something you can take in a high dose for a long time
Mhm.
and then potentially have a curative effect for something like your insomnia over
Mhm.
time.
Yeah. So
So,
I got the like one of those half-gallon size jars in a metal stainless steel tea strainer, and I ordered the giantest bag from was it Mountain Rose Herbs of loose leaf tea. And so I will literally make a half gallon of it. And sometimes I'll drink that in one day because I'm like and it's funny because sometimes it's that first sip, I'm like, oh my gosh, this is so good. My body is craving it.
yeah,
Um, but it's also passion flower is one of the teas that I've recommended for years just to help with stress,
right.
So and I, it's like you share things and you teach things and you kind of fall off of them. And so it's so fun to come back to this. And I just think it's such a fun, getting healthy doesn't have to be stodgy and clinical and boring. You too can have a plant ally, which just is so much, it's just so much fun. And just what a great tool. It's tea.
Yeah,
It's not a prescription, it's not Xanax, right? Like it's not melatonin or something that's going to knock you out because you can't sleep.
yeah,
And it's just I love the concept of taking you being doing this giant assessment, getting to know someone over time and really being able to assess that. And it was funny because when I was researching the plant after that, I was like, oh, it says passion flower is a weed and it can grow anywhere. And I was like, I love being a weed because I can pop up through concrete, through the brick in your house, through, like the dirt, it's like I'm used to growing in hard places. And I identified with being a weed, which is so random. But it made sense to me in my self-assessment. Oh my gosh, I'm a weed. Okay, so do you have a plant ally?
it changes over time. I think my plant ally right now is actually green tea is my
Oh,
plant.
okay.
So green tea is high in L-theanine, it's calming, it's energizing. Running a busy practice every day, it connects me back to the roots of what I do, which is very much rooted in Chinese culture and a way of life, where green tea was used for literally everything for
Okay.
years, including still today. If you go to a restaurant in China, like rural China especially, they'll wash their dishes with green tea and that's it. So beware.
What?
Take your herbs for food poisoning if you travel to China.
Okay.
Because washing stuff with green tea.
I have never heard of that in my life. That is fascinating, but what an interesting way to do it. Seems like it would be kind of expensive to wash all your dishes in green tea, but
It just grows so rampantly there. It's like in everything. It's
gotcha.
like black pepper here, I guess, or I don't know what else you would
Yeah.
relate it. Yeah.
That is too funny. Cheryl, do you need a plant ally? Y'all
I
need to
do.
have
I
this
was very interested.
conversation.
I was very interested. I was like, I think I'm the same one as Becca. I don't know.
Cheryl
You
and
see the
I are
notes?
very similar, so in a lot of
Yes.
ways. So,
Yeah.
Amanda Thomas,
She
which who
says she wants one
she
too.
says she wants one too. Amanda's like, I want to plant. I mean, I'm telling you, the concept is so fun. It's just fun and empowering and delightful. I don't know. I just think everybody needs a plant ally. So
Yeah.
if you don't have one, then go see go see
Hey,
Megan and she can hook you up. And what I love about too is if you order these gigantor bags of blue sleeve tea from Mountain Rose Herbs, one, the quality is phenomenal. But two, it's not expensive. I mean, that one bag is lasting me forever. And I'm someone that I like to batch and I like to make things in bulk because, I'm running around like a crazy person. And so being able to make a giant thing of it and, keep it, and, drink it over a couple of days. It's just fun. There was something else. The pulse. Megan, can you tell us a little bit more about, because we do the tongue and the face and all the things, but what is it? Like most people are like, oh, your pulse, you're alive, right? What's your heart rate? Do you have high blood pressure, right? But with what you do, what is that pulse? What are you checking for?
Again, we are checking for the movement of life force energy through the channels, the movement of chi, and the quality of that movement, and the state of the energy movement through the internal organs, and therefore the state of health of the internal organs. But we're looking in that quality, we can also tell very simple things like, are you inflamed? Are you dehydrated? Do you have high blood pressure? Are you having issues with your vascular integrity? Like, is your cholesterol high? And that's why you have high blood pressure. Or is there an issue with your heart organ itself because there's an irregular beat, and there's that. So we're looking at those things first and foremost. And then there is a extremely refined and complex art to the level at which you're feeling, from the most superficial level of putting your hands on someone's wrist, like so, and then going deeper and deeper and deeper. There are multiple channels that we understand that start kind of right on the surface of the body and then go deeper into the internal organs. And so we're actually looking at the flow of energy at the most superficial level all the way to the deepest level to figure out what channels are implicated and what needs to be treated. And each finger position relates to two different channels and organs, the yin yang pair of organs that are related to that, what we call an element.
And again, it's such a cool tool because it's non-invasive, it doesn't hurt, and you can learn so much about the body. Most of my diagnostic testing is very expensive, looking at a stool sample or urine sample or a hair sample, but there's so much available to you within the framework of going to see an acupuncturist like Megan, where you get so much diagnostic support, so much like just immediate support with like an acupuncture session, and then long-term support, of all of these like different tools she sets you up with. And I just think it's so interesting. And I love that there are just non-invasive options out there for people to really fast track healing. I can tell you, I've gone in with severe headache, with exhaustion, with, just horrific muscle spasms. And I'm like, I just lay on the table. I'm like, just fix me, do your magic. And I leave every time I'm like, my nervous system, it thanks me. My nervous system says, thank you. I feel so much better. Headache's gone, spasms gone. It's just such a great option out there. So if someone, so Megan practices in kind of central Texas. So I know there's gonna be people watching this who aren't in Texas, but if you're in the Austin, Dripping Springs, Bee Cave, San Marcos, Kyle area, that Central Hill Country area, where can people find you? Where are you located specifically? How can they book with you? Because I want more people to come see you because you are changing people's lives. So tell us all about it.
So I have a clinic. It's a 2-room clinic. I see 2 patients at a time. I'm located on Nutty Brown Road. So those of you who are from the Austin area will remember the Nutty Brown Cafe. So it's right down the road from that. It's on a horse farm, Signal Hill Ranch, which is cool too, because you get to come out, see the horses, and just take a breather and relax. Nutty Brown is really on the edge of Austin. The address is technically in Austin. So for folks in Austin, I'm like, you're going in the reverse direction of traffic. You have a gorgeous drive down 1826 to get here. And it's really only 10 minutes away. So you can fight traffic for 20 minutes or come see me in 10. Really kind of South Austin area, but then close enough to serve Dripping Springs, Wimberley, et cetera, as well. I occasionally have patients who are driving down from as far as like Round Rock,
Nice.
Waco even. Just depends, if I'm your person, that's
Right.
great. Always happy to make a referral. But if you want to come see me specifically, just you can see my website, coyoteacupuncture.com. And there's online booking there.
Okay.
Or just send me a text. Text is great for me. Don't have to call, don't have to make it complicated. I'll get you on the books and see you at your first appointment.
Where can people find you on social media?
I am mostly active on Instagram. I'm coyote.herbs is my Instagram
Is your
handle.
handle. Okay.
I
Awesome.
post Facebook, but I'll warn you right now, I'm not on it very much.
Yeah.
So probably the worst way to contact me is through Facebook.
Okay. Well, and then what another cool thing Megan offers is you can just book her an appointment. Go try it out. She's not gonna use like hardcore sales tactics to try to, get you to see her for the rest of your life and, give her your firstborn child. That's not what this is about. But if you, I will, here's my leprechaun, take it. But if you do find that it's something that helps you, then she also offers multi-session discounts. So like the last time I was working with her, I did like a package of, was it 10, 8? How many was it? 10? And to make it even, more budget friendly. And after my first session with her, I was like, sold. I knew I wanted to come on a regular basis for a number of weeks to kind of do I wasn't in a maintenance phase. I was in a very reactive, like, let's get this show on the road phase. And so I knew personally that I wanted to come more often. And I'm going to be doing that again at some point, probably later in the summer, getting back on track with that. But Megan is phenomenal. You can't go wrong. Cheryl, do you want to give a little testimony? She's like, I want to talk now.
So I see Becca, love, and we've been through this journey together that has started crazy, like I don't know what I would do without her. And then one day she just said, I really think after my testing, she's like, I really think that you need to go see my friend Megan. She's an acupuncturist. And I was like, no, I was like, you were kidding. Like, I can barely do what I'm doing now. And you want me to go see her. There's just no way I can do this. I was so scared. I was so nervous. And then, of course, she brought up her son, how he's so much younger than me. And that,
I was like, if Noah can do it,
and all this, he can do it. You can do it. And the same thing what Becca said, whenever I walked in, I just felt comfortable. I felt at home. I felt very secure. I felt very safe. And we went through the whole process and everything. What I love about Becca and Megan together is that's my support team. And that's the two people that, are together helping me and talk about it and to share everything. And I walked in with back pain, I walked in with anxiety, I walked in with insomnia. I'm actually sleeping now, everybody. I'm sleeping. And I mean, it was like either I woke up at 12 and I stayed up the whole time, or I woke up at 12 and then didn't go back to sleep, or slept just till 12. I mean, like, it was just crazy. So now I'm working on that. And Megan looked at my tongue yesterday and she was like, hey, it could be these things. I'm like, this is crazy. There's some things I didn't even tell Megan. And just looking at my tongue, she told me. And I'm thinking, like, how did you know that? Because I didn't put that on my paperwork. So,
she's all knowing. She will find out.
Yeah.
Amanda says Megan knows things.
She does. She's the best. Yes. And so, and I've only been, Megan, going on almost a month now, maybe. I think maybe a month.
I'm you, Cheryl. I just wanted to say you have
Thank
done
you.
so well, and the commitment is so commendable. So you've been a great patient, and I think it's reflected in the results that you see,
Yeah. No.
Really.
Yes. But I do want to know my flower. So, but that's what has helped me is the combination and getting there. And I'm there are days where I'm just like, I just don't want to go because of the needle thing.
Mhm.
But she makes it very comfortable for you, and she has for me.
Yeah.
So,
Well, and it's like, when you're working with someone like me, we're working on gut health, we're working on nutrition, we're working on getting rid of toxins, we're working on reducing inflammation. But if your energy channels are stagnant and blocked, your progress is going to be slower than it has to be. And so when you kind of create this team, like Cheryl was talking about, it's like I'm working on stuff and Megan's just like taking all the work you're doing with me and like amplifying it, making it work better, work smarter, be more effective, work faster, right? To where, and then of course you don't have to work with someone like me. For those of you, I didn't actually introduce myself on this. I'm a functional diagnostic nutrition practitioner. I work at the root cause level, supporting people to figure out what's going on to cause their chronic symptoms so they can stop wasting time, energy, and money on doing random things to solve their health issue, to get real strategic, and then they can go live their vibrant lives. You know, so many people have worked decades to create this life, and then they feel so bad that they don't get to enjoy it. And like, we're gonna snip that in the bud. So sometimes it's just working with me, sometimes it's working with Megan, but when you combine forces like this is where some really amazing magic
It really does.
happens.
Meg was like, I'm going to get you to the point where one day you're just not going to have to come, but like every once in a while, I was like, but what if I want to come see you?
Then you bring your plants LIT and you just have tea.
Yes. Yeah.
Well, Megan and Cheryl and Amanda on the chat, I appreciate y'all joining us so much. So go find Megan at Coyote Acupuncture and Herbs, and like seriously, she will literally be like, okay, these are the herbs. Come back in a few days. I'm making your tincture myself. I mean, I don't even know. She's magic. So, all right. Well, we will see y'all next time. And thanks everyone for
Thank you.
joining us.